Hey everybody, it's Brittany Knott with the Cultured Experience, and as you all know, November is Diabetes Month. So we are educating you to a point where you can understand in more simple terms. One of the things that I hear is a lot of times patients go to the hospital and doctors and nurses don't really explain things to them in a way that they can understand. So that's what we're doing. Now, diabetes. I talked a little bit about it the other day, but I'm going to talk a little bit more about it. So, as you know, your blood sugar gets high, your pancreas is not able to produce enough insulin so that it can compensate for that high blood sugar. But there's, I want to say technically 3 stages. So, we have prediabetes. What prediabetes is you're not quite diagnosed with diabetes just yet, but you got the high blood sugar. So your blood sugar is high and you need to start making some lifestyle changes to not be diagnosed as a diabetic. But then you have type 1 diabetes. And what is that? Well, your pancreas is producing little to no insulin for your body. So you require lifetime coverage, and some people are just kind of born that way, or they just found out later in life that they have that. Diabetes type 2. Now, diabetes type 1 and diabetes type 2 is a chronic situation, but with diabetes type 2, lifestyle changes can kind of help correct that. So if you are managing your diet, if you are exercising more, you can keep your A1C down. Your A1C is a number that help gauge or how the doctors and nurses are able to kind of gauge what your blood sugar is like and what it's been like over 3 months, around about 3 months with evidence-based practice. Things are constantly changing, but about 3 months, what does it look like over that period of time? They do blood work and, all of that stuff. So for people who have diabetes, your A1C number kind of helps us. But with diabetes type 2, like I said, you have lifestyle changes. There are things that you can do to manage. You can watch what you eat. You can exercise. You can kind of keep your sugar down so that you don't have to worry about giving yourself so much medication. Okay? All right. So we are going to start learning things in a manner that we can understand it so that it keeps us out of the hospital. Because that's what we want. We want to keep you out of the hospital and we want to keep you around your family. So in order to do that, everything starts with education. So that's what we're going to do. We're going to start educating. We're going to talk about it because that's what I'm doing at the Cultured Experience. It can't just be me, y'all. We talking about it. So like, share, follow, and subscribe the Cultured Experience podcast on YouTube, where you guessed it, we talking about it.